lady, she has an amazing perspective based on her background of what she was doing career wise. So I'll let her share that with you. But she's one of our top referral partners, and she's been a major advocate of impact and what it can go out and do for her community. And that's Courtney Carpenter. Courtney, thank you so much for being on the call today.
Awesome, Jeff and Melissa. Thank you both so much just for letting me come speak this morning and putting this amazing call together. Guys, like Jeff said, I have a background as a pediatric nurse. My specialty was NICU, and so we literally took care of sick and super ill children and babies. And I actually heard about healthcare sharing back in 2020 because we would have like patients and their families would come into the hospitals and they would be using MediShare and Samaritan and Christian Health Ministries, some of these other health sharing companies. And I always loved the idea of healthcare sharing as a theory. But like Jeff talked about, impact has completely shifted. Like the accessibility of healthcare sharing made the technology so much better because what would happen was when these other companies would come in, they're doing a lot of good, but it was a pain for the providers, like the medical staff, us, to try to figure out how to get these surgeries done in time. And they were cash paying for these big procedures. And it was also a pain for the patient or the family because they're trying to navigate healthcare billing. It's like one of the most complicated things ever. They didn't have impact to negotiate and deal with all of that for them. So again, I always thought, wow, like if healthcare sharing could actually work like insurance, that would be the best thing ever. And then fast forward to 2022, got introduced to impact, and I'm like, oh my gosh, this is exactly what so many, I mean, millions of Americans need this. And so just from the being in the medical industry for so long, just want to give you guys like real conversations that doctors and nurses and medical staff are having. Guys, people don't understand that doctors, unfortunately, even really good doctors, unless they are doing their own thing and they're just completely bypassing insurance where everyone's a cash payer, their conversations behind the door, like the door of the patient, sound like this. Okay, this patient needs this medication for this treatment, but their insurance is going to deny it. So we're going to give them this other medication, and this other medication isn't exactly what they need, and it's going to give them XYZ side effect. So now we're going to prescribe two or three other medications to cover up the side effects of the first one. And so people don't realize like if they were even if they had good intentions of wanting to give the patient or the client what they actually need, they can't. They're not practicing medicine, they're practicing insurance. So that right away, learning that impact was more affordable just in terms of premium, that it was good for both the patient and the provider, that they pay the doctors in less than 30 days, that they negotiate all of that complicated stuff on behalf of the member. I was blown away. So I've actually personally been an Impact Health Sharing member as my sole healthcare coverage for going on 2 years now. It's been phenomenal. I really use telehealth a lot. You heard Melissa and Jeff talk about telehealth earlier. You know, if you guys are busy like me, you understand that it can be super frustrating trying to go in and wait forever to be seen by a doctor, and then they just write you a prescription and you're out the door. So literally with telehealth, you log into Impact. Within a few minutes, I'm on a Zoom call basically with a doctor. They write me a prescription, and I got a text within 3 hours that it was ready at my local pharmacy. I mean, it's such an amazing experience, and it cost me nothing out of pocket. I mean, that is like next level care right there. Second story is because of Impact, guys, you really truly get to choose your own doctor. Like Jeff and Melissa, Impact, they're not just saying that. And you guys probably agree with me when I say this. Not every doctor is created equal. You don't have to be in the healthcare industry to understand that. But just like with anything, there's going to be professionals that are better than others, or maybe just doctors that you connect with. So when I first became an Impact member, you know, I opened up all of these different people that I could go to. And I remember I found a PCP that owned a women's clinic. I loved everything that her practice stand for. I scheduled her in, you know, and scheduled an appointment with her. And my first appointment I had with my PCP, she was like, "Tell me about Impact. You know, I've tried healthcare sharing, but you know, kind of brought up some of the billing conversation we talked about earlier." And she goes, "I've never really used it." She goes, "But when I pull up your Impact card when we went to pay for the appointment," she goes, "This pulls up as commercial insurance, like Jeff said." So she was like, "What in the world is Impact?" So I talked to her about it. I said, listen, Impact will actually write a contract with you. Doctors can become what's called preferred providers. So she, within 2 weeks, Impact had negotiated a contract with her. And now she called me a couple days ago and said, Courtney, this is the best thing ever. She goes, I know that when my patient needs a specific medication or a specific intervention, I don't even have to question if Impact's going to allow me to actually offer that. They're going to pay for it. They're going to allow that to process. They're not going to fight me on what I know is best for my patients. So again, that just speaks volumes, guys, about how it's good for every party. And last story is we actually had a customer, an Impact customer, a few weeks ago. She actually decided to enroll in Impact Health, even though she had a pre-existing condition. You heard them talk about that earlier. Sometimes it can still be a really good plan even with a pre-existing, and her pre-existing condition was pretty minimal, doesn't really cause a lot of issues. So she was an Impact member for a couple months, and then recently she actually did have to get admitted to the hospital for a complication related to that pre-existing condition. And her medical bill was $38,000 from being inpatient for about a day. And guys, Impact reduced that to $2,200. And so she paid $2,200 because it was related to a pre-existing condition. But guys, she was paying over $1,000 a month for Blue Cross Blue Shield before Impact. So she was like, I'm happy to pay a $2,200 bill one time as opposed to paying like almost that much in premium every single month. So cannot say enough good things about Impact. We are so thankful that Impact has become what it's become, and we're really excited about bringing this to so many different Americans. So Jeff, thank you so much for letting me speak today. I'll give the call back to you.